Hello, welcome to our Q&A session, House Bill 2359. My name is Elizabeth Sanchez. I'm a certified medical interpreter with the National Board, and I'm also an interpreter that is in the Central Registry in OHA. I'm also the founder of English to Spanish. Let's get started with our House Bill 2359 conversation. This took place or became effective July 1st of 2022. What is House Bill 2359? Let's talk about that. It's a new ruling that makes it mandatory that healthcare providers who are reimbursed with public funds work with a qualified, certified healthcare interpreter who is listed in the Central Registry. Let's break this down a little. I think it's clear to all of us who healthcare providers are. Let's talk about public funds. What are public funds? Public funds are any grants received from the state or federal. It's also any Medicaid dollars. So this is anything like Oregon Health Plan or Medicare. Qualified certified healthcare interpreters who are listed on the Central Registry. Qualified and certified interpreters, qualified meaning they are trained, they are in the process of getting certified. And certified just means that they went through the training and they went through a national agency to go through their certification. So they're recognized as a certified interpreter in a national level that are listed on the Central Registry. So in order to get onto the Central Registry, which is managed by OHA, you either have to be qualified or certified as a healthcare interpreter. So let's read this one more time. It's a new ruling that makes it mandatory that healthcare providers who are reimbursed with public funds work with qualified or certified healthcare interpreter who is listed on the Central Registry. Are there any exceptions? Yes, the law has listed 3 exceptions. The first one being the healthcare provider is proficient in the preferred language of the person with limited English proficiency. The second one, the person with limited English proficiency has an interpreter they prefer to work with, who is not on the Central Registry. For the second one, I highly recommend that if that is the case, you document on the notes that this is the reason why you're working with an interpreter that's not on the Central Registry. The healthcare provider tried to find an interpreter using the Central Registry, but no interpreter was available. In this case, usually it's not the healthcare provider who is trying to find an interpreter using the Central Registry. There are some providers that work directly with interpreters. If that's the case, you want to document that there were no interpreters available that are listed on the Central Registry. If you go through your agency to schedule an interpreter, then you want to make sure and have a conversation with your agency to make sure that they are abiding with this piece of the law. What are we doing to recruit and keep interpreters in this profession? Just like any workforce, we are experiencing a shortage of interpreters in Oregon. English to Spanish is offering scholarships, working with Pacific Source to train more interpreters. OHA has waived the registration fee and removed some requirements which were barriers, and this allows it to be easier for interpreters to register on the Central Registry. What does this new law require healthcare providers to do? I think this is an important piece of this new law. Healthcare providers and interpreting service companies such as English to Spanish are required to attempt to find a healthcare interpreter who is on the Oregon Healthcare Interpreter Central Registry. It not only we are attempting and giving preference, we also have to document this. Should healthcare providers document? Yes. OHA may request this information and will use it to assess the progress on transitioning to working with healthcare interpreters on the central registry. The record keeping requirements include the full name of the healthcare interpreter, the healthcare interpreter's central registry number, if applicable, and the language that is being interpreted. So these are the requirements and what we need to make sure we're documenting in each note. Again, the full name of the interpreter, the central registry number, and the language that is being interpreted. What is English to Spanish doing to abide with the House Bill 2359? English to Spanish is working mostly with qualified and certified interpreters already. We've been doing this for quite some time. Preference is always given to OHA interpreters. And when I say OHA interpreters, it means interpreters that are qualified, certified, and registered on the central registry. And we have documentation of this. So if we were to get audited, we're able to provide either our clients, our partners, or OHA this documentation where we're always giving preference to interpreters that are in the central registry that are qualified and certified. And for each visit, we're able to provide the documentation requirements of each interpreter. Our scheduling system. Our scheduling system is an online scheduling system that is HIPAA compliant. It's very user-friendly. It's perfect for a small team or a large team. You get notifications, either text or email or just on your online portal. The administrators have full control. So you have full control of your team. The communication is direct with the scheduling team. You can communicate directly to our scheduling team if there's any changes. There's a way to upload documents, information for the interpreter, and we're able to send you that information or those requirements, documentation requirements through our platform. And we are also able to, through this scheduling system, we're able to give preference to those interpreters that are on the central registry. If you have any questions for me or for the House Bill 2359, I'm happy to help. I also would like to take you to the website of OHA so you can get further information. You can see where you can find any updates. So I'm just gonna go ahead and just share. Our email is admin@englishtosspanish.com. If you have any questions regarding the House bill, I am happy to help you. If I don't have the answer, I think that together we can find the answer, and it would be a great opportunity for both of us to learn. So here you will, so we're going to go to the Oregon Health Authority website, to the Office of Equity and Inclusion. Here in the bottom, you will find the Healthcare Interpreter Program. We'll click here, and here you'll find information about programs, how to become an interpreter, just different information. But the important information I want you to check out is right here where it says Healthcare Interpreter Program Changes Fact Sheet. This has great information. It has some questions, common questions that have come up, talks about the House bill. And something that I would like to mention is that the documentation requirements are listed here, and they state that they will take effect on September 1st of 2022. This is coming up, or we're very, very close to September. If you're watching this after September, it is time for us to start documenting when every time you work with an interpreter with these following 3 requirements. And I also would like to mention for remote interpretation, so this could be video remote or over the phone, this law is not going to be effective for remote services until 2023. I can tell you that English to Spanish, even though it's not taking effect until next year, we are already giving preference to interpreters that are on the central registry. Here you could also find contact information, links for additional information, and Q&A of the House bill. You can also find the registry for interpreters. This is the central registry that is mentioned in the House bill. I will put my name down so you can get an idea. Put first and last name, and I show up twice as qualified and certified, and this is the registry number that will need to be documented in each encounter. The full name and the language that it will be interpreted. And you will find here the name or the language, name, and the registry number. And this is information we're able to provide. The registry number is unique to every interpreter, so each interpreter has a unique number attached to their registration. Again, if you have any questions, feel free to call us or email us. Again, I would love to learn together if you have a unique situation. And our email is admin@englishttospanish.com. You can go into our website and see the services we offer and our phone number and any additional information. Thank you so much. Have a great afternoon.